One of the most common questions we receive as urogynecologists is, why do women get more bladder infections than men? Well, the simple reason, we think, is that the urethra in a lady is about 3 to 4 centimeters long. Not that long. Whereas in men, of course, it's longer. All bladder infections are infections that move from the outside in. We also see more bladder infections that occur as a woman goes through menopause and loses her natural estrogens. We see a lot more infections in the 60s, 70s, 80s, and actually sometimes life-threatening infections that are due to infections that start in the bladder. They can move up the ureters, which are the tubes that go from the kidneys to the bladder, and up into the kidneys and actually cause infections to get into the kidneys and into the bloodstream. So they can be very serious infections. But most bladder infections just affect the bladder and are easily treated. Bladder infections are typically caused by bacteria that come mostly from the bowel, such as E. coli, Klebsiella, bacteria like this. In the woman's vagina prior to menopause, there is a material secreted called glycogen. Glycogen is a protein structure that feeds a good bacteria, the probiotic for the vagina, called lactobacillus. Lactobacillus does two things. It first of all creates an acidic environment inside the vagina, which helps to inhibit the growth of bad bacteria such as E. coli and Klebsiella. In addition to that, it also, because it's there already and in large numbers, competes, and so it doesn't allow those bacteria to get a foothold inside the vagina. So one of the reasons that we commonly use vaginal estrogen after the menopause is not only to help with sexual discomfort and feelings of dryness, but also to help prevent bladder infections by allowing the vagina to once again secrete glycogen to help the growth of lactobacillus and to help restore a healthy bacterial flora. For more information, please consult our video library or make an appointment and speak to your healthcare provider at Women's Healthcare Associates.